Hello everyone, I'm Dr. David Nyeko. I'm a medical doctor at St. Mary's Hospital, Lacor, and I'm currently the head of accident and emergency unit at the hospital. I've been in Lacor now for the past 3 years, and I would like to say that it's quite a good opportunity for me to actually be here and help patients. However, today I've been asked to discuss how we are coping up with the COVID and what's its impact on the community and especially our patients and also the neighboring people around us. So, COVID has really struck us hard from all fronts, from the clinical aspect, from the social aspect, and the political aspect. In basically all aspects of life, COVID has really affected service delivery in the hospital. I would like to begin with a brief situation report for Uganda as of today, 1st May 2020. We recorded 83 new cases, and all these cases, we had a recent spike in the number of cases, mostly from the truck drivers who are coming across the border with the cargo, notably from Kenya and Tanzania. However, most of the cases that we recorded as a country from the early days of this pandemic were mostly imported cases. Fortunately, most of them were quarantined, and even the case follow-up, epidemiological follow-up from the Health Ministry Epidemiological Survey team, all the contacts turned out to be negative. So it's quite reassuring at the moment. However, I would like to say that we've not yet registered any COVID-related death in Uganda. We did have a few suspected cases, but the results eventually came out negative. Those were cases from Lacor Hospital about 2 days ago of patients who were intercepted at the border and referred to the Lacor Hospital, but they were in critical condition. So eventually we had to take some samples, but it turned out to be negative at the moment. Yes, I know you're gonna ask how have you been prepared for this? Yes, after the WHO declared COVID-19 has a disease of public health importance and emergency, measures were instituted immediately. As for Lacor, because of our history of dealing with some epidemics such as Ebola about 15 years ago and as recent as 8 years ago, we already had an infectious control team on the ground, which actually, just sprang into action, and they started instituting these measures immediately. This, however, was supplemented upon by the Ministry of Health as they started training the health workers on what needs to be done and what we need to expect out of this COVID. So this training went on. It covered a lot of aspects, more notably in the use of personal protective equipment, which fortunately were supplied. But it would be hard for me to really say that in the event of a massive outbreak here, I don't know how long that might go. But fortunate with this social distancing program the government has instituted, we have not yet registered any case in Lacor Hospital. So what did we do as a hospital? Yes, one was designing a tool, a screening tool. These were disseminated to the various entry points into the hospital, that is the outpatients department and also our accident and emergency department. So these are the two main entry points within the hospital. So these tools called for one, decongestion of patients, so we implemented a social distancing policy. And two, we also started asking patients, we designed a new medical form where the distance between you and your clinician, we instituted it to be 2 meters. So we provide patients with the masks, and also the clinician also would have their own mask, and put up different spots within the hospital for alcohol-based sanitizer, the dispensers on the different walkways, and also hand washing facilities. So this patient comes from home or from other referral centers, we expect them to follow the same protocols. So by the time you get to see the clinician, that's the doctor or the specialist or any of the working staff members within the hospital, you're expected to follow up on these measures. So part of the history in this design form indicates a history of recent travel, symptoms such as cough, fever, shortness of breath, and we're looking at also your history of contacts with anyone who might have this, and also history of attending large gatherings such as funerals, wedding, or in a sort of a political rally. So these are the things that we're trying to capture and determine the risk of these patients to others. So if we determine that you're high risk, some other additional measures are instituted, such as I would also ask you to probably be in a separate place where additional tests are also equally done. Now, yes, this condition has affected a lot of things. One of them is access to hospital services, especially since government introduced the curfew. Vehicles that would normally bring patients to the hospitals, personal vehicles, public transport means the buses, the taxis, and also the most common means of transport here, the border, the motorcycle, they've been banned from carrying passengers. So patients with the real critical illnesses are not attended to. So at the moment, I really can't say for certain that we have statistics related to non-COVID death in the community. We do not have that. And also, its impact has actually been felt more in maternal child health. So we do have these mothers, high-risk mothers with high-risk pregnancies, who are supposed to come to the hospital for regular checkups, the antenatal care, follow-up visits, and also those with the emergency cases, such as those who have postpartum hemorrhage, those with obstructed labor. They are unable to access these services. So the government came up with a little bit of an option for them. That is, you have to get a letter from your area local authority or the resident district commissioner, but it takes quite a long process, and most of these people are in hard to reach areas due to poor road transport, also maybe due to quick decision making by any person in that area. So by the time they make the decision that, this person needs a hospital service, sometimes it's a little bit to reverse the kind of damage, especially in as related to maternal death. In Lacor Hospital in the past 1 week, we've lost 2 mothers who came in particularly with the postpartum hemorrhage, and also blood shortage, and it was not a nice situation. It's sad, and the same has also impacted child health, especially for those children under the age of 5. They are unable to come to the hospital. Those who have chronic conditions, maybe sickle cell anemia, most of them who come here come due to lack of blood or sickle cell crisis. They are in severe pain and they are unable to make it. So this has become quite a challenge for us, and we're trying to liaise with the district authorities to see that a little bit of exemptions are given to them so that they can actually use the same means of transport to come to the hospital, and also timely referral. There's this tendency of coming in late when we've already missed the golden window to actually reverse their conditions, which is quite unfortunate. So yes, the main problem is the government curfew. It has paralyzed a lot of activities, also from a medical perspective and also from the social aspect. People are unable to walk freely, interact. Human beings by nature, we are social beings, so and that is very common here in Africa, where people normally tend to congregate together. And yes, there's a social stigma attached to it. One, if we look at the early days of HIV/AIDS infection in Uganda, it was people who had contracted this virus were stigmatized. Now, the same we are seeing it being reciprocated on patients who have COVID or COVID suspects. Most notably, a case in one of our neighboring districts called Arua Regional Referral Hospital, whereby 4 patients tested positive, and all of them were truck drivers from South Sudan. They were Kenyan drivers who were headed to South Sudan, intercepted at the border, and they were quarantined at the hospital, and their results came out positive. The local community there wanted to, break in well, I wouldn't want to imagine what they would have done to the patients, but fortunately, the local security personnel there were deployed. and they had to maintain order. So yes, people are being stigmatized, and even those who've been discharged. We've seen reports from the Ministry of Health at the National Referral Hospital who've been discharged back home. Some of their relatives are not willing to accept them as their own. So it has caused a little bit of social isolation as well for them besides the virus. So it's quite a very unnerving experience. And then what about in Lacor specifically? You did talk about, we did spoke about at national level, district level. What about at the hospital? Yes, we are coping up. We, besides instituting all these measures on the ground, the social distancing, hand washing, and the hospital has made it a priority to regularly train health workers. Even in our daily practice, we've been provided with a personal protective equipment, notably the N95 masks, the surgical masks, the gloves, also the use of hand wash facilities or even the alcohol-based sanitizers, and deploying only essential clinical personnel to attend to the or to the isolation unit. Those with non-essential workers, especially the non-medical support staff, some of them have been asked to take leave from work so that we reduce on congestion within the facility. And the hospital as well has scaled down on its elective case, especially for the surgical procedures. Now we only attend to emergency procedures, both surgery, general surgery, and also from the gyne and obstetrics department. The other thing is we've been having companies come in to donate goods, especially to the patients who are in the hospital. We've seen the dairy company in Gulu supplying the hospital. We've seen the banks, they've also been supplying a few supplies to the patients around. So yeah, I think the hospital has done relatively okay, but the main issue here is the social aspect, the stigma. It's not been nice. It's something that we have to consider working upon it. And also the turnaround time for the test is quite long here. It's about 3 to 4 working days. So that means in the process of you having a patient whom you've isolated and while waiting for the results, there's a little bit of unease even within the health personnel and also the public. So it causes a lot of tension and anxiety. So if we could only try to shorten it, like I've seen in Europe where some people are doing this test now in less than 2 hours. So it would be good if we could replicate the same over here. And also I think ultimately we'll have to rely on the vaccines that might eventually help us deal with this pandemic, and life as we know should be able to return to normal. Yeah, I wish we had a Q&A session. I would be glad to answer that. But for now, thank you so much, and I'm indebted to you. Thank you.